Good morning friends, my name is Brian Adriel James Rajkumar. I'm currently doing my 4th year medicine here. I am from South India, placed in Andhra Pradesh. I'm from Telangana, Hyderabad. Okay, so how did I get here? I got here through a Transworld agency. They brought me here and they promised me a good medical education, and I'd say they've lived up to their promises. Initially I did my BS and BS Brokenshire. Brokenshire BS had taken place for about 6 months. Post 6 months we had joined DMSF. Now I'm here to tell you all about DMSF. DMSF is a speculative system here where we are evaluated a lot from 1st year to 4th year. Now explaining each year as a whole, right now I'm sitting in the 7th floor of the new building. This new building is composed of many rooms and each room is individualized. Individualized for a program called the SGD. What is the SGD? SGD is a small group discussion where students will gather for the discussion. They will have a pre-test and a post-test, and they will have a discussion in the middle. Now the topic for the discussion will be given one day prior so the students can prepare for it and assess. They will be assessed on a graph. The graph which will assess the pre-test evaluation score and the post-test evaluation score after the discussion. The discussion will be facilitated by a teacher who will be also teaching the students on how to go about the topics. Well friends, this SGD is going through all 4 years. You will have the SGD in Physiology and Biochemistry 1st year. You will have the SGD in Gen Pathology 2nd year. You will also have the SGDs in all the subjects in 3rd year, such as internal medicine, such as dermatology, such as ENT. You will have the SGDs all throughout, and that's why this flow serves as utmost basis. So what about now medicine? How are we evaluated in medicine? In medicine, DMSF has a very competitive system where we are evaluated through multiple choice questions. Yes, we do not have long answers, and yes, we do not draw, but we are evaluated on a competitive basis based on multiple choice. Now let me explain that more certainly. In the multiple choice evaluation, you have your evaluation exams and you have your term exams. You will have numerous evaluation exams and you will have 3 term exams. That's the prelim, midterm and pre-final. And this will happen for each semester. You might ask me, what is the passing percentage here in Philippines? Here in Philippines, guys, is a step ahead where we need a 50 percentile pass. Take for example, the exam is 30 points. You would need to score at least 15 on 30. The evaluation system is taken as such. Take for example, 30 points. You score 15 on 30, 1 by 2. So it's 1 by 2 into 50. Into 50 is equal to 25. So it's 25 plus 50. This plus 50 is given for your class attendance, your class exposure, how participative you are in the class, and how many times you answer. So all of this is taken into a united spectrum to give you the final 75 percentile pass percentile rate. It's based on the US system. So us as students will be also preparing for the USMLE. And I've got a girl from my batch who's gone and attempted the USMLE right now. I got to find out from her how well it's gone. But apart from that, my friends, we are very competitively trained, even for the MCI. Believe it or not, the IMD 9 batch, they have scored the 2nd rank, the top 2 ranks in the MCI, and they've got 4 ranks in the top 10. That is a spectra. Wow. Now we can take their examples and join in the same coaching centers because we are pre-trained here for the competitive exams. Apart from the competitive training, my friends, you may ask, what about the clinical exposure? You're only being educated. We do get clinical exposure as well, my friends. Me in 4th year medicine, my batch has an immense strength of 703. Now with this immense strength, how do they manage it? They manage it very beautifully, I'll tell you that. They split us into 2 halves, 350, 350. Now the first 350 are again split into 7 groups where we are put into hospitals. So the major of the 7 groups, example, each 350, we are going for different subjects. Each subject has 70 in set A, 70 in set B. Now the 70 in set A are split 35, 35. The first 35 is sent to the government hospitals to work for 2 weeks. And tell you, government hospitals are a rough ride. You've got a lot of patients to take care of, and with a lot of procedures. The procedures we do are ABGs, atrial blood gas. We do NGTs, nasogastric tube insertion, orogastric tube insertion. We do IV blood cultures for the assessment. Since the doctors in the government hospital also have a lot of diagnosis to do, we assist them in the diagnosis by getting all these procedures done and by submitting them to required offices. The system over here is very systemized, where you have everything documented and encoded in paper so that you get it registered in the computer so that the whole hospital will know what test you are doing. Now this system is very complicated, so that you can get into it and get an idea of the system. You would need to spend your 3 years initially here, where they teach you about the complications of the system and how well you can get engrafted into it. Now this is just a government hospital. When the private hospital, it is equally as complicated. So yes, we are exposed to the medical world, but as to how much the level a student needs to be exposed, and you will be seeing different cases. All that we have read in our first, second, third years, we see them practically in the fourth year. But again, the amount you see is up to you and your interest you take in the hospital patients. Apart from that, my friends, I would also like to tell you about the international students. We're all internationals here, aren't we? So as internationals, we would have to renew our visa on a daily basis. Now, is this a hectic process and does it give it a headache? No, not at all. Right here in the school, we have the facilities of the FSU, the Foreign Students Unit, where they collect our detailed information required for the visa process, and we do it on a yearly basis. The visa renewal is a yearly process where we do our renewal yearly basis, we fill in the forms, submit our passports, and get it approved by the embassy, Philippine embassy, where we get our visas re-stamped and rescheduled. I've sent my visa already and waiting for the approval. Once my approval comes in, I will renew my ACR, that's Alien Credentials. I will renew that and give me a permanent license in Philippines up to next year. But next year I'll be graduating, which means I won't have to repeat my process. Yes. But apart from that, my friends, you may ask, well, you've told me about the studies, you've told me about the visa. Do you have anything fun in your college? Yes, we do have a lot of fun activities coming up as well. But the choice is you got to manage fun and education. By fun and activities, we have a Cerebral Quiz Center where we conduct quizzes every month based on different topics so that students will have fun and learn. By fun activities, we also have a newspaper editing committee, that is the Chiasma, where we edit the students' lifestyle, the students' aspects on the world, and the students' portrayal. And that is done every month. Again, you will have fun and you will have education. But apart from that, we also have drugs in the sports activities such as the volleyball, football, throw ball, basketball, and guys, believe it or not, as Indians, we also have cricket. The cricket leagues are going on right now, and we have competitive students competitively playing there. So guys, with all this in hand, DMSF is a handful, much more than you can handle, but again, you are here for medicine. My only advice to you guys is come here with the will to become a doctor and to study, because this is a tough road ahead, but with you being fully equipped and with a warrior attitude, yes, you can do it. Well friends, that is me, Brian Adriel James Rajkumar, 4th year medicine, reporting you here today. Thank you all my friends. Thank you, thank you, thank you. I'm finished.